Hello and welcome to our new episode of Visite. And thank you very much for all your information, questions, and also cases that you send to me. I picked one today and it's about a 6-year-old little girl with juvenile arthritis. That means this little girl has a rheumatic disease. And you were so lovely as a mother and sent me a treatment report. That shows me what has been discovered about this disease and how it is treated now, of course. But you also write to me that the little one who fell ill in 2017 since then has been on medication, and yet the clinical picture again and again is a subject. The little one cannot walk for long. She limps, is in pain. She is on anti-inflammatory drugs, which she must take regularly. And the question is directed to me now. I think as a second opinion it is asked. What more can we do? And also respect for the immunosuppressants, for these anti-inflammatory drugs. I see the epicrisis, I see the reports from the hospital, and of course also see the course that the child has been treated with painkillers since the onset of the illness. The diagnosis is within the framework of the imaging, so x-rays have been done a number of times. One has seen inflammation parameters, one has seen increased ANA, these are rheumatic antibodies, and thereby set the little girl to the corresponding accompanying medication. I have no other findings now, but when I read this, I thought of another case of a child does not fall analogously into this time, but that is not important now. At least it is also a child which came with similar symptoms. We care for a number of children with insulin-dependent diabetes from 1 hour to the next, from 5 to 6. The children are now 2 years old and the diabetes occurs. And of course, also this disease, juvenile, means the child rheumatism. I'm going over to the other case now because I think it makes it a little bit visible to you how important it is to be able to diagnose yourself a little further. And above all, try in the life of the child, in the life of the family, but also to recognise the current state far beyond the imaging. Why this balance between staying healthy and getting sick has developed like this for the little one in your case. And the diagnostics in every child, which I always find incredibly valuable, is to recognise whether it is a child who has cryptopyruria. 10 to 15% of all people have cryptopyruria, and these people, or even children, are conspicuous by a multitude of symptoms. They can be prone to allergens, they can become prone to milk crust very early. Sometimes they have mental health problems that they are quite actively being curious and interested. They are highly intelligent, but sometimes they cannot be put in a structure. There are a large number of diseases or abnormalities in children that are not noticeable at all in childhood or early childhood, but then later, when life is demanding, develop diseases through a certain disposition to allergies or atopy, neurodermatitis, and these children, and that's what I want to get to, have a daily loss of vitamin B6 and above all zinc. And zinc, you will hear that again and again, is one of the most important trace elements, and without zinc, intracellular immunity cannot actually be sustained. Without zinc, the regeneration of cartilage, joints, hair and skin is difficult to achieve again and again. Without zinc, there will be over hundreds of enzymes, and enzymes mean reaction A to reaction B. There are hundreds of thousands of biochemical reactions that naturally depend on the administration of zinc. For example, this is a very, very important diagnosis that has to be confirmed or excluded whether this child has a cryptopyrroluria, but if it were, then of course it also becomes clear that the adaptation to life, the adaptation to stress, and the situation of the growing body makes it a lot harder to guarantee the same task for this organism. This is important because if you overlook this, then this equalisation will not be able to take place on its own either, especially since I could experience it very clearly with that child. That the food was limited to only a very few dishes for the child, because she is simply a bad eater, and so that she eats something at all, she can eat what she wants, and everything that is very, very high quality, such as sufficient vegetables and vital substances, smoothies, this is not in the child's menu, which of course you have to add 2 and 2 together, that this is not compensated by the nutritional side. The other is the constitution of a child, which can be seen in the eyes. Our child had blue eyes, and blue eyes indicate a lymphatic constitution. Lymphatic patients should not be confronted with cow's milk at all until the age of 6 or 7. That means there is an immunology memory the body turns against the cow's milk. It is a foreign protein. And a child who is not breastfed and is fed with substitute food, so baby food, it cannot utilise this cow's milk well, and inflammatory reactions occur constantly. For the anamnesis, it was then the little one kept having anginas, swelling of the lymph glands, had mucus build-up, also got antibiotics again and again, was fully vaccinated. This means that this small immune system had a lot to compensate for in the first year of life, and was actually no longer able to cope with this burden on the other side. The other thing is that everyone is examined for intact intestines, and our child had a so-called leaky gut syndrome. She had complete dyspepsia. That's how it's called when the bacterial flora is out of balance. That means there was an increased Candida fungus load, because the pathogenic germs clearly got the upper hand, because the healthy flora is characterised by lactic acid bacteria, lactobacilli bifidobacteria, but also from Escherichia coli or Enterococcus. These are really very important immune germs, were no longer sufficiently available, and a flora has spread, which of course was dramatically fed through sugar and through a constantly one-sided diet. The family lives with 2 cats. Here, of course, the question also had to be clarified with that child. Is there exposure to Toxoplasma gondii, which also repeatedly forces joint problems? And so with this child came an abundance of parasitic loads. On top of that a leaky gut syndrome is an increased permeability of the intestinal mucosa. And maybe I can explain that again very briefly. The intestinal mucosa is the border between the intestine and the organism, the body. And this border is so highly sensitive and seals off the body bunker-proof, so that nothing at all, reaches it, that would now claim immunity again, to rid the body of these toxins. Therefore, this barrier has to be really tight. The intestinal mucosa introduced 2 control systems, and these control systems were broken away from the child from recurring small inflammations. And every silent inflammation, that's how it's called, any chronic inflammation is damaging. Chronic inflammation is a danger. Therefore, every person must also be examined for latent chronic inflammation, which they don't actually feel, but over the years, and sometimes it only takes weeks, of course, can create a change. And it is precisely in the intestinal mucosa that porosity really arises, and everything that should actually leave the intestine can come to the physical level unhindered. Now it is in the blood, and now the blood has to be able to, of course, process, recognise, fight this load of endotoxins is what they call it, which get from the small child's intestines into the blood, whether the bacteria are fragments, whether they are parasitic loads, or whether these are fungal loads. These are a lot of things for a small immune system, which is now in a phase of life where it should build up, where it should be strong, where it can also build up a healthy defence. But it can constantly feel overwhelmed at that moment. And of course, the inflammation is now carried over to the physical level. These are things that we could clearly see here. In addition, there was also a load of chlamydia. Chlamydia are also bacteria that are not usually examined. We check the child for a lymphocyte transformation test for Borrelia. And here too, there was an active response. So you always look at the reaction of the immune system in a dispute with a chronic bacterial fungal contamination. You can prove that very clearly, and a lot of information came together that now needed a structure. That of course began in the first place with making the intestines functional again. The child also had stomach pains from time to time and stool irregularities. This means that you take care of this little intestine very intensively and recognises this so-called permeability syndrome. A stool sample can prove this without any problems. This diagnosis can be excluded or confirmed very quickly, and that's where it begins. The intestine, as the root of the human plant, is the most important thing. You can't expect that the tree will become strong, German oak, if the intestine is still desolate. And of course, our children nowadays have a different diet. They are also burdened with many other things. And we are all different in our adaptation to what burdens us. But a little intestine that is too early accustomed to cow's milk and cow's milk products in general will always feel disturbed by little things somewhere, and now just really needs to rest in order to really allow, let's say, a healing tendency here. And it might not make that much sense now, to tell you what is the next therapeutic step. But it makes a lot of sense to rule out a cryptopyrroluria for your daughter. It makes a lot of sense to do an examination for nitrosative stress. With this, we see to what extent the cellular health is in balance at all. How is mitochondrial health? So what is the energetic situation of the cell? To what extent is the cell supplied with sufficient vitamin B12? It's very important to have a big mineral and trace element status done. It is very important to know an immune status at all, because one can see from the immune status to what extent the viral problem is perhaps more dominant. These are preliminary examinations that can already guide, is it an intervention for viral reactivation, or is it bacteria who support a chronic rheumatic ailment here? The fact is there must be something behind it, because the child is never symptom-free, and the inflammation that is now reduced by anti-rheumatic drugs and also by cortisone is there somewhere subliminally and is only regulated selectively. And of course, such a long-term cortisone dose results in unbelievable side effects for the little ones, because this is also about bone health in the long term. Mineral deficiencies that can be recognised, whether that is manganese or selenium or zinc, must of course be really targeted and consciously be refilled and checked again and again at large intervals. Inflammation parameters are to be measured. I would recommend to also measure the high sensitive CRP, because you can see the silent inflammation in it. Then it is essential to have a large stool analysis that shows us what the child's microflora is like. Is there a fungus, candida strain? How do the liver and pancreas actually work? How is the fat, protein and carbohydrate digestion? Are there digestive residues? One can determine on the basis of the digestive residues how functionally intact is the liver. How functionally intact is the pancreas? Of course, when the pancreas is in somehow weakened, then it is no longer just maybe a bacterial and viral load. Maybe it's ammonia pollution too, because in the breakdown of the protein and a suboptimal breakdown of protein in the small intestine due to poor digestion of the pancreas, scatole, hydrogen sulfide and ammonia are formed. Ammonia then also gets into the bloodstream much faster and has to be converted to urea and uric acid by the liver. You all know the gout which then causes this joint pain or the insanely sore red toe. But there is also a gout through bread. There is also a gout or inflammation of the joints in a completely different way, and you should really know all of these things through a stool sample. You don't see that when you simply look into the intestines with the human eye. And 95% of the findings from a colonoscopy are by and large quite good. But we found, and then it is a polyp, or you cannot really make any statement about the functional performance of this organ that carries 80% of our immunity. We can also use the stool sample to see to what extent there is inflammation. These are parameters like calprotectin and alpha-antitrypsin. We can measure the zonulin as a marker too of the open mucosal permeability. The same applies to the other previous markers. We can see what the mucosal immunity is like. That is the secretory IgA, and the inflammation of the mucous membrane becomes visible by the alpha antitrypsin. This secretory IgA tells us whether the mucous membrane has a good defence to the inner and outer world or a reduced defence. That's very, very important because it's the inward boundary. And you have to stabilise this boundary, this mucous membrane again. And of course that means afterwards that all the findings of the intestine have to be evaluated first. And it has to be a colleague, please, who is very familiar with these things to then really develop a therapeutic plan for the little one. That step by step creates the prerequisite that what could develop, it could always only develop on what developed weaker afterwards. That one goes back this way step by step, and the stability then slowly builds up again from the depths. There are healthy children after childhood juvenile rheumatoid arthritis, but it will take a little time too. And above all, what is very important to me, the inflammation which repeatedly triggers itself has to be recognised, and before that, one must not rest. To think of Lyme disease, to think of toxoplasmosis, of chlamydia. There are also a number of many other bacterial causes as well. But that is all in a different relation when first of all the intestines are healthy, because then a certain load cannot get into the body at all. That's why I have to put a lot of emphasis on it again. And everyone is well advised, whether child or adult, to have a stool sample examined once a year so that one can anticipate such a development that gets into imbalance somewhere and can stop and discover it earlier. I would think it would be great if these stool exams, gastrointestinal diagnostics and stool exams, would also be a common preventative medical checkup. And preventative means to ensure beforehand that it does not arise tomorrow. With a colonoscopy, I can't see anything in advance. Either it's there and then I'll be late, but with the functional condition of my intestinal mucosa, the activity of all the glands located in the upper abdomen, such as the pancreas, the liver is also like a large gland, it produces bile. I really can't see anything when I look into it. A colonoscopy is important too, but it is not a good way to say that everything is fine, or to say, I see a polyp. I cut it and classify it as a pre-cancerous condition. Something can develop from it, and then don't act for a year or two, but just look in again and see whether another one has grown or not. These are things which I think are very, very, very promising. As a doctor, you can't just say it like that, but I want to say it because I speak from experience. In my opinion, the medical profession is not necessarily a highly scientific one. It's a big, experienced profession because, of course, you also learn from life and observe life and also decide in life what was it actually that brought this person back to health. But I hope that you will now find people in your environment who will accompany you on this path and who, above all, initiate these investigations. And so maybe in the long term, adjust the medication, of course, That must be a trilogy with the treating doctor, the rheumatologist, and of course you as a family. That you can slowly lead the child out of this disease. I have forgotten one thing. If she is the firstborn or the secondborn, please do not underestimate the toxic exposure of the mother for 9 months can also be passed on to the child, and sometimes the firstborns are also the more burdened children. And of course every pregnancy also wears out a mother. And you can actually determine toxic exposure in children very quickly by means of a connective tissue measurement. Is there an increased exposure to aluminium, lead and mercury? That's another big point as to why. If the child has cryptopyrroluria and is low in zinc and B6, then there is a risk of limited detoxification capacity of the liver, and that runs at all times and every day and 24 hours, a very strict cascade of biochemical reactions. And these biochemical reactions rely on B6 and zinc. Just to give one example, they depend on a child having enough selenium. And sometimes I'm a little worried when I see that these are parameters which are not necessarily important to us in everyday life, in the examination of healthy children, but the children have a deficiency. Today they no longer have enough selenium, which is as a trace element, very crucial and important for detoxification. And with that, they cannot detoxify. But this detoxification now does not only concern the detoxification of what occurs in the metabolism itself, it concerns what children also have to compensate for during this time. And that is the weakest is vulnerable. The weakest is the one who may also be vaccinated and get aluminium, thimerosal, all these things through the vaccination. And then, of course, it is in the loop that there are always infections. And in the end, a disease somehow really only shows one thing. The body is compensating its stress somewhere in a very difficult situation. And only then it has a symptom. Only then it calls via an inflammation, or I don't know what other symptoms it naturally shows us, whether it's a headache or a migraine. I wanted to give you these thoughts on your way now. It has been some time, and all of these things really need to be clarified and discussed with a colleague who also sees this to this extent and then takes your little daughter's illness into their hands and accompanies her caringly. With this in mind, I wish you all a wonderful Sunday evening, and I am very much looking forward to the next one. Goodbye. Dear viewers, the preceding episode is an indicator for a holistic medical approach and does not replace visiting your family doctor. Thank you.